Have you ever noticed feeling unusually sad, tired, or unmotivated when the seasons change? For many people, these shifts in mood can feel minor, like the winter blues. But for others, these changes are more intense and interfere with daily life. This condition is known as seasonal affective disorder, or SAD, a type of depression linked to the changing seasons. SAD often begins in the late fall or early winter when daylight hours get shorter and symptoms usually fade in the spring or summer. This is called winter pattern SAD or winter depression. Some people, however, experience the opposite, a rare condition called summer pattern SAD or summer depression, where symptoms emerge during the warmer months and improve as the days get shorter. It's important to understand that SAD is not just a reaction to the holidays, stressful schedules, or family obligations. Instead, it's tied to how our brains respond to seasonal changes in light and temperature. Let's explore what causes SAD, how it affects people, and what you can do to feel better. First, what does SAD look like? Its symptoms are similar to those of general depression, but have unique seasonal patterns. Common signs of SAD include persistent feelings of sadness, hopelessness, or emptiness that last for most of the day, nearly every day, for at least 2 weeks. People with SAD often lose interest in activities they once enjoyed and may feel fatigued or have difficulty concentrating. Other signs can include changes in sleep and appetite, physical aches without a clear cause, and, in severe cases, thoughts of death or suicide. In winter pattern SAD, people frequently experience hypersomnia, oversleeping, a craving for carbohydrates that leads to weight gain, and a tendency to withdraw socially, almost like hibernating. Summer pattern SAD, on the other hand, often causes insomnia, poor appetite leading to weight loss, restlessness, anxiety, and sometimes even aggressive behavior. But why do some people develop SAD while others don't? Several factors contribute to this condition. Researchers believe that SAD is linked to disruptions in the body's internal clock, or circadian rhythm, caused by reduced exposure to natural sunlight. This disruption can affect the brain's production of serotonin and melatonin, two chemicals that regulate mood and sleep. Serotonin, often called the feel-good hormone, helps stabilize our mood. Shorter daylight hours in winter can reduce serotonin levels, which may lead to feelings of depression. Meanwhile, melatonin, a hormone that helps regulate sleep, may increase during the darker months, leading to excessive tiredness or lethargy in those with winter pattern SAD. For summer pattern SAD, the opposite might occur. Long daylight hours and higher temperatures can reduce melatonin production, worsening sleep problems and heightening feelings of anxiety. Vitamin D deficiency is another factor. Our bodies produce vitamin D when our skin is exposed to sunlight, and it plays a role in serotonin activity. With shorter days and more time spent indoors during winter, people with SAD may have lower levels of vitamin D, further contributing to mood disturbances. Interestingly, SAD is more common in women than men and typically begins in young adulthood. It is also more prevalent in people who live farther from the equator, where seasonal changes in daylight are more dramatic. For example, SAD is more frequently reported in Alaska or New England compared to Florida or Texas. Genetics may also play a role, as people with a family history of depression or other mental illnesses may be more prone to developing SAD. If you think you might have SAD, recognizing the symptoms is the first step, but an official diagnosis requires a healthcare professional to confirm that your symptoms follow a seasonal pattern for at least 2 consecutive years. They may ask you to fill out a questionnaire and rule out other possible causes of depression, such as stress or other medical conditions. The good news is that SAD is treatable, and there are effective strategies to help you manage it. Treatments fall into 4 main categories: light therapy, psychotherapy, antidepressant medications, and vitamin D supplements. Often, a combination of these approaches works best. Light therapy is one of the most common treatments for winter pattern SAD. This involves sitting in front of a light box that emits bright, artificial light, about 20 times brighter than regular indoor lighting, each morning for 30 to 45 minutes. The goal is to mimic natural sunlight and help regulate your body's internal clock. Light therapy is generally safe, but people with certain eye conditions or those taking medications that increase sensitivity to light should consult a doctor before trying it. Psychotherapy, particularly cognitive behavioral therapy, CBT, can also be highly effective. CBT SAD is a specific type of therapy designed to address the unique challenges of seasonal depression. It helps people reframe negative thoughts about the season and build healthy, enjoyable routines to counteract symptoms. Behavioral activation, a core component of CBT, encourages individuals to engage in activities they find meaningful, even when their energy levels are low. Antidepressant medications, like selective serotonin reuptake inhibitors, SSRIs, can help balance serotonin levels in the brain and alleviate depressive symptoms. The extended-release form of bupropion is another medication approved specifically for preventing SAD when taken daily during the fall and winter months. However, medications can take several weeks to work, so it's important to be patient and discuss any side effects with your healthcare provider. Vitamin D supplements may also provide relief for those with winter pattern SAD, especially if they have a documented deficiency. While some studies suggest vitamin D can be as effective as light therapy, others have found minimal benefit, so its effectiveness may vary from person to person. Prevention is another key consideration for those with recurring SAD. If you know that your symptoms tend to start in the fall or spring, beginning treatment early, before the season changes, can help reduce their intensity or even prevent them altogether. Establishing healthy routines, like regular exercise, spending time outdoors, and staying socially connected, can also help manage symptoms year-round. It's important to remember that SAD is not a personal failing or something you can simply snap out of. It's a legitimate medical condition that requires understanding, patience, and the right support. If you or someone you know is struggling, reach out to a healthcare provider to discuss treatment options. By learning more about SAD and how it affects the brain and body, you can take proactive steps to manage its impact on your life. Whether through light therapy, talk therapy, medication, or lifestyle changes, there is hope for feeling better and regaining control over your mood and energy. If you're interested in understanding more about mental health, emotional well-being, and practical ways to overcome life's challenges, subscribe to our channel. Together, we'll explore the science behind the mind and share actionable tips to help you live a healthier, happier life.